I'm Caitlin White, and this is the 360 of the room. So, hi, I'm Caitlin White, and I'm going to be performing an abdominal exam on you today. Is it okay if we get started?
Yeah.
Okay. So first, I'm just going to take a look. I'm just going to lift your shirt up a little bit. Just kind of tuck it here. Just take a look at your belly. So on inspection, your belly is flat. Your umbilicus is midline and inverted. I see no bulging. The skin is free of scars, rashes, or lesions, and I see no dilated veins. I also see no visible peristalsis or aortic pulsations. So next I'm going to listen. So I'm just going to take a listen to all four quadrants for bowel sounds with the diaphragm of my stethoscope. All right. All right, bowel sounds are active in all four quadrants. Now I'm just going to listen for any friction rubs over your liver and your spleen. So I'm going to do that with the diaphragm of my stethoscope as well. Take a deep breath. All right. Take a deep breath. All right. No rubs noted in over the liver or the spleen. Now I'm just going to listen to the different arteries in your abdomen. And I'm going to do that with the bell of my stethoscope. So I'm going to first start with the aortic. No bruits heard. And then I'm going to move along to the renal arteries. No bruits heard. And then I'm going to move along to the aorta, the iliac. No bruits heard. And then I'm just going to do the femoral. I'm just going to slightly. No bruits heard in the femoral arteries either. Lastly, I'm going to listen to the epigastric area with a diaphragm to listen for any hums. And there is no hums noted in the epigastric area. Now I'm going to move on to percussion. I'm just going to do some percussion in the 9 areas of the abdomen. My hands are cold, I'm so sorry.
Okay.
So. Tympany was heard in all 9 areas of the abdomen, which is an expected finding. Now I'm going to percuss to figure out where the liver span is. I'm going to start from the midclavicular level here until I hear dullness. All right, and then I'm going to go up from the bottom. All right, and that was about here. And the liver span is about 3 inches. Now I'm going to do splenic percussion. So I'm just going to leave my hand here. And tympany was heard. I'll have you breathe in too when I do that. Okay. Tympany was heard before and after inspiration, so that indicates no splenic enlargement. Now we'll move on to the palpation. So this is going to be just light palpation. It shouldn't hurt, but let me know if anything does. All right, the abdomen is soft and non-tender. There's no guarding or rigidity. Now I'm going to move along to a little bit deeper palpation that shouldn't hurt, but let me know, okay? All right, the abdomen remains soft and non-tender with deep palpation, and there's no masses noted. Now I'm going to palpate your liver, spleen, and kidneys. So I'm just going to go ahead and palpate your liver, and I want you to take a deep breath for me. Okay. The liver edge is smooth and non-tender, palpated just below the costal margin. Now I'm going to do the same technique with the spleen. I'm going to have you breathe in. Okay. The spleen is non-palpable, which is what we would expect. And just do the kidneys, breathe in. All right, and kidneys are also non-palpable, which is a normal finding. Now I'm going to check for CVA tenderness. I'll have you stand up and face the wall over there. Okay, so I'm just going to lift your shirt up so they can see. So I'm just going to find where her last rib is. Okay, so roughly there, and I'm just going to thump you and let you know, or let me know if you have any pain. No? No pain. No pain? All right, I'll have you lay back down. So CVA tenderness is absent bilaterally. Next, I'm going to assess for ascites. Just by looking at her, it does not seem like she has any ascites, but I'm still going to perform the test. So we would start at the midline here at the umbilicus and go over and listen. I'm hearing tympany, and listen for any dullness. She does not have any dullness, most likely because she doesn't have any ascites. But if I did hear dullness, I would then have the patient roll to their side and wait 15 seconds, and then I would tap again and see if I hear tympany. She still has tympany there, but because there's no ascites, which is a normal exam. Okay, you can roll back. So she was negative for shifting dullness and fluid wave. Now I'll perform the 3 tests for appendicitis. The first one is the Rovsing sign. I'm just going to palpate the left lower quadrant, and I want you to let me know if you feel any pain in the right lower quadrant. Nope. Take a deep breath. All right, no pain. No pain felt in the right lower quadrant when I palpated the left lower quadrant, which is a negative Rovsing sign. Next will be the psoas sign. So I'm just going to have you try to lift this right leg against any pain in the right lower quadrant? Nope. All right, so no pain in the right lower quadrant with this movement indicating a negative psoas sign. Next, we're going to do the arbitrator test. I'm just going to flex your knee and your hip at a 90-degree angle and just slightly inward. Any pain?
No pain.
All right. So no pain with internal rotation indicating a negative arbitrator test. Finally, our last test is to test for cholecystitis using the Murphy sign. So I'm just going to go ahead and palpate you here, and I want you to take a deep breath. All right, the Murphy sign is negative. The patient was able to take in a complete full breath without any halts or pain. That completes our abdominal exam. Thank you.
Get up.